The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. I'm your host today, Rebecca Miller, along with Otto Lohse, the Project Independence and You permanent co-host for a very long time. How are you this very cold morning, Otto?
Nice. It's a good day. It's a good day.
Good day. You didn't get too
nippy.
cold traveling to your office?
Yeah. It was a long walk.
It was a long walk through the house. Well, good to see you.
Steps.
And of course, we have our radio show producer extraordinaire, Christina Liu, who puts these shows together every week.
Morning.
Good morning. And we have a great guest today. I'm so happy. This is a topic that we haven't really talked about. I know we kind of talked a little bit about it over before we started the show, that I don't think we've had somebody on talking about the topic that Dr. Rosanna Sabini will be speaking about. And thank you so much for joining us this morning, Dr. Sabini.
My pleasure to be here.
Great. And Dr. Sabini, you're with physical medicine and you're a rehabilitation specialist for Northwell Health. So we do have a lot of questions. And you're primarily going to be talking about, unfortunately, senior falls. It happens yes. to everybody, every age, but also concussions. You know, you hear so much about concussions with young people and football players and the effect that it has kind of built up over the years. But, you know, it's true because I've trip and fall and I've, hit my head too. But I know that it's different for seniors. So what is it? I want to say the typical patient you see, but what generally happens with the trip and fall when a senior, may bang their head and then they wind up in some kind of physical therapy because of a concussion or the injury to the head?
Sure. So let's just first kind of define what a concussion is. A concussion is a type of head injury. Now, there's many iterations of what head injury is, and there's also the extreme, which are the more traumatic brain injuries that you hear about. So concussion tends to be in the more mild range, but when we do talk about the elderly, any type of injury to the elderly can be much more significant, just because the age factor, unfortunately. As we age, we tend to become less resilient. And so the impact of any type of infection or injury can have a higher toll on it. On someone who's a bit older. So when it comes to specifically concussions and head injuries, and I see all sorts. I work at South Shore University Hospital, where we're a level 2 trauma center. So we get to see pretty much the bulk of all these types of injuries, and including my outpatient. So if someone falls, they'll be evaluated either in the emergency room or by their primary care physician, and they'll assess just sort of the severity. A CAT scan is typically recommended just because when you age, the brain tends to shrink and it tends to rattle a little bit more and pull on certain veins, and you're more susceptible to certain bleeds. So that has its own consequences down the road. But just even if that doesn't happen, it can affect sensorium, so how people think and remember and pay attention. You can develop headaches, you can develop dizziness, you can have other pains related to the fall, not just your head, that limits the ability to move. So it's very important that if there is a fall and there is a change in the individual, whether it's your family member or yourself, you should definitely get checked out because you need to be evaluated for potentially even more serious disease.
Do changes last sometimes? In other words, like, may they be a long-term proposition that just don't go away?
So it's possible that in certain situations, when we're thinking about concussions, that symptoms can last more prolonged time. Typically, I'd like to say that within a month's time, folks should recover. But when we're talking again about the elderly, that resiliency factor, that ability to recover, jump back into things tends to be a little bit slower. So we have to take into consideration that having had a concussion is not in itself in a vacuum. There may be other injuries that happen. So those things can prolong recovery. From a cognitive perspective, it's possible that if you've had a little bit trouble with some memory, that may have gotten worse. So it depends really on the severity of the injury and to get assessed, because really without that initial assessment, it's really hard to then say how do things evolve and what is attributed to what. So that's why I tell everybody, if you are in that age range where you're a little bit more frail and it's harder to move and you do get injured and hit your head, you should definitely have that initial evaluation.
When you talk assessment, like if you watch football games, they talk
Mhm.
about the player is going in for concussion assessment. What do they
Mhm.
actually do? How do they
Yeah,
how do
so
they
for
assess that you've had a concussion?
so for specifically athletes, there's a specific protocol. It's called the SCAT. It's the Sports Concussion Assessment Tool. And that's done typically on the sideline, and it looks at your balance, it looks at your level of alertness, your orientation, it checks on your memory. They'll give you 5 words to remember, and then they'll ask them to you again. They'll ask you to repeat numbers backwards. And that's typically in that field of injury. When we're talking about more the elderly, it's going to be a little bit more serious in terms of how we approach it, because again, the elderly are more susceptible to potentially having not only these bleeds, but also other injuries. So they're going to be assessed full-fledged neurologically. So they do an entire neurological assessment. They'll do a CAT scan just to make sure that there's nothing going on and rule that out.
Could I ask you a question then? You mentioned CAT scan, all right?
Yes.
I hear CAT scan, I hear MRI, and I'm
Mhm.
not sure a lot of people really know the difference between the two. Could you kind of just tell us what
Sure.
that is?
Good
So
question, Otto.
yeah, so a CAT scan, the beauty about the CAT scan is that it can give you a quick picture about what's going on in the body, and what it can really detect very quickly is a bleed. So that's why you can roll someone into a trauma center and quickly do an assessment, roll them into a CAT scan, pretty much do a full body CAT scan, and within 20 minutes have an idea of any internal injuries. So that's good for really basic assessment. It really looks at bones. When you're looking at more tissue, such as the brain. So let's talk about the brain. So an MRI really can, it has different ways it can look into the tissues to look at the integrity of, for instance, the actual intracellular structures. So for instance, an MRI, which one does take a longer time, so we're not going to do that emergently when a trauma comes in or with a concussion, because it's more prolonged and it's a little bit more intense for people to tolerate because it's very noisy and loud. It will look at how water can move across different tissues. So if, for instance, you've ruled out that there's a bleed, but you sense that there's something else going on, it can actually look at nerve having been damaged. So in, for instance, high speed car accidents, there's actually stretching of nerve tissue. And the MRI can actually tell you that there's been this type of stretch, which tells you that there's been more significant brain tissue damage, which a CAT scan would not be able to really tell you unless it was really severe, that there's these tiny little blood pieces everywhere.
You know, it's interesting that we have you on the show now talking about concussions, because I have to say a huge percentage of the programming that Project Independence does for the seniors in the town of North Hempstead is balance, preventative falling, what to do in ice and snow. I mean, we do fitness classes, we're doing, yoga and Tai Chi. So many of the things, I don't want to say that we preach, but, that we kind of, instruct people to do is to be a little bit more careful day to day, because we want to try to so much avoid trip and falls, because it's so tricky. If somebody falls and, they could hit their head, and maybe not even know that they do, and there's a period of time where you could even lose consciousness for a few seconds or something and not really understand. So, we do a lot of programming along with Northwell too. We do programs with them and really trying to make people aware of not just, learning how to be a better balance, but reasons that you may lose balance. So you have to be aware whether it's medication or whatever the reasons are. So, and this is one of the not that we want to avoid seeing you, Dr. Sabini, because,
you do, you should.
Clearly, but, it is also good to know that there is something that can be done, that there is physical therapy, there's ways to manage. And, but it just sounds like people have to really, just get checked out. If you fall, you could really do damage, I guess, without even completely being aware of it, especially if you're taking a fall from standing and you hit your head at all, because that's like there could be some damage.
Yeah, and certainly if they're walking, what kind of surfaces are they walking on? Certainly concrete and gravity do not mix very well. I actually just saw someone who fell on actually his ceramic floor in the kitchen, and he wished he had fallen on his carpeted living room for those reasons. But it's fantastic to hear that this program does promote preventative ways, because really that's the best thing you can do. Unfortunately, we all have a risk of some sort, and it's always, trying to mitigate that risk of that fall that could potentially lead to complications such as a brain injury.
I'm sorry, but we use mindfulness a lot of times. We talk about it on this show, and I'm thinking myself, I try to be mindful when I'm walking on stairs or carrying something, or look around and make sure I don't trip over something that's laying on the floor. I think you have to really be mindful of the moment.
Absolutely. And as we age, our senses become a bit altered. So we have to rely on more visual cues to get us an idea of our balance. So our feet tend to decrease the information that comes to our brain about what the surface is. And we just need to absolutely be more mindful and not try to be superheroes and think that we're still as young as we were, which is great to feel inside. But the reality is, as independent as someone can be with any injury, you're more likely not to bounce back as well. So it's important to just mitigate, go easy and slow.
It's like there's like a level of acceptance you just have to accept as you get older. And I have too. I can't do the things I once did. Maybe I can, but I could get hurt, so you have to I have a stepmother, and she is mid-80s, lives in Florida. She is cognitively fully there, and she's always been a go-getter, doesn't rely on anyone. Gets in her car, goes here, does this, helps, gets involved with the community, does the community newsletter. But her brain is so there in every way, but her body isn't, and she's falling a lot. And I'm always like, Lynn, you got to slow down. God, if she's listening, she's going to kill me. But just you have to kind of accept it. There's like a point where, once you do, and I like what you were saying, Otto, you have to become aware of your feet. I'm also a yoga teacher. And one of the things that we talk a lot about is, kind of the body as a whole. So like, our phone rings, remember when it used to be on the wall, we used to have to get up to answer our phone, right? So we would get up, we'd run to the phone, but we don't think about our feet. We just expect our feet to go along with our brain. Oh, okay, got to get the phone, and we have to be more aware, especially as we get older. And this is one of the things I tell Lynn. I'm like, you have to just accept it. And there's nothing wrong with accepting it, because you could be the best you at this
That's
point
right.
too.
You talk about feet, all right. I myself have that, like I wear sneakers a lot. Now they're supposed to be good because they're not slippery. However, if you don't lift your feet, the sneaker can stick on the ground and you may go forward. And I've had that feeling, so the point I think is you have to lift your feet when you walk. Don't shuffle if you
Right.
can avoid it, because shuffling is what causes sneakers to stick to the ground
Yeah.
and you go forward or,
Yeah.
I
Unfo-
find to that I'm just gonna some sneakers are so heavy.
Yeah.
Like the senior
Bulky.
sneakers, the bulky and heavy. And I mean, I right now still wear like a lighter sneaker, so it's much more. But Otto, I wonder if there's something with the weight of a shoe too that kind of keeps your feet not lifting. I don't know.
well,
Yeah.
Dr. Sabina, do you have an
Yeah.
opinion?
Well, I mean, so there is evidence to say that our proprioception, which is kind of that, again, that sensation you feel in your extremities, your body, that your brain is aware, right? So if you were to say, okay, where's my left foot? Can you feel it in place? And that gets distorted when we do age. And so that sensation, along with our vision and our inner ears, all come together to formulate balance. And so unfortunately, as we age, because we've used our feet so much and our vision has decreased, we tend to lose these sensory abilities that ultimately impacts us on our balance. And so the more attention that you can provide to your own body and the environment is another way you can mitigate that potential risk that folks have when it comes to their balance and falling.
It's interesting you mentioned hearing. I wear hearing aids, and when I don't have the hearing aids in, when I first wake up in the morning, otherwise I wear them all day. But when I first wake up, everything is so quiet. I hear nothing, and I wouldn't hear my feet if they got stuck on the ground. I don't hear it. So I think the point is that I didn't ever really connect hearing to things like balance, but I think there is a connection.
You know
There
what?
is,
Touch
yep.
on that. I'm so sorry. We have to
Yeah.
take a quick break. We'll be right back. We're listening to Dr. Rosanna Sabini, and she's with Northwell Health. We're talking about senior falls and concussions and managing it all. We'll be right back with Project Independence and You.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
And welcome back to Project Independence and You on Community Talk Radio, 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with co-host Otto Lohse and radio show producer Christina Liu. We've been speaking with our guests, getting a lot of great information, Dr. Rosanna Sabini. And, like we were saying early on, we have a lot of kind of preventative programs so that, to prevent falls and just balance and promote balance. And, of course, there are falls. I mean, that's why there are so many programs to prevent it. So, but there is also, even if you do have a concussion or a head injury, there's a lot of help. So I won't say what's the typical process, but if you do have a senior who comes in and has a pretty, I won't say severe concussion or head injury, what's kind of the process and the plan for their recovery?
Okay, so typically folks that I see will either be in the hospital or in my outpatient office. So if they're in the hospital, and even if I don't see them, somehow we will transition them to our outpatient office. It's rare that they'll need in-house rehabilitation. And for the most part, most people seem to fare fairly well and see me in the office. And when they come to see me, I do my neurological assessment, which includes just a neurological assessment, as well as how they're thinking and paying attention, their language. And I do actually assess balance and walking. So in the more severe cases where folks are complaining about headaches, they're having neck pain, they're feeling dizzy, if they're having some cognitive related issues, we will actually refer them to our physical therapy counterparts. So typically we may recommend them for PT for their neck. Oftentimes when you hit their head, it's almost somewhat like a whiplash, and they end up doing cervical PT. That neck pain can refer into the head and can actually help relieve the pain that they're experiencing. And then we also have what's called vestibular therapy that will address the balance and vestibular disorders. So vestibular is the inner ear part of the balance system, and that directly addresses that aspect of it so that we can make sure whether there is some sort of positional vertigo going on or some trouble with the movement of how the inner ear functions in terms of balance, we can assess it and as well provide the treatments and also provide home exercises for the patient to keep doing. And so that is the extent of it. Now, if there's also complaints of, say, memory issues, attention problems, I typically like to wait a little bit, because if we try to clean up some of the physical symptoms that they're having, such as headaches, neck pain, dizziness, which can impact on their day-to-day as well as their sleep, we try to focus on that first. If after we've addressed all that and they've recovered, they improve, but yet they're still sensing these cognitive inefficiencies, then we will refer them to a neuropsychologist for intake, where they'll really take their brain and look at it from the inside out through pen and paper testing, where they're put through all these battery of tests to just really get an assessment of what the difficulties are.
Sometimes I would assume that people fall because of a stroke, which probably compounds the issue a little bit, I would think. All these symptoms you mentioned could really come from a stroke, right?
Sure. So I've actually seen that happen where the patient comes in after a fall and you find out they actually had a stroke. So the stroke happened first and then caused the fall. And so you can see both of those diagnoses happen. So we're always trying to address the functional and the cognitive findings that we see so that we can address them and improve their outcomes.
Very interesting. It's also, I've been in a situation, I'm just taking like personal thought, where I suspected someone had something going on, where they just weren't themselves. Their gait was a little off. It was just like a couple of things. And
sure,
it's like, is there, as someone that is, either living with someone or is close with somebody who's maybe a little bit older, is there some way to kind of determine if they're in trouble? I mean, in terms of maybe if there was an injury, is there something I could do to say, like, ask them a few questions or say, hey, look, see if you can balance, or, is there something that someone that's living with someone that might suspect something's going on could do to kind of
sure.
get
So
the best hands?
Yeah, so if certainly a close relative is living with them and just, there's a history of a fall and they sense that something's off, whether they, feel that they're repeating a story that they've said several times, or you keep reminding them of something that they need to do or have to do, or even has done, or they're just walking a little bit slower, or you feel that they're, as they're moving, they seem kind of off and confused, I would suggest that it's just best to get folks evaluated. As I mentioned at the beginning, the elderly, their brains tend to shrink. And when they shrink, it tends to pull on these little frail veins in the brain. And when you fall and hit your head, the brain can shake a bit and can actually pull those tethered veins, and it can actually cause a slow bleed. Now, I've seen some patients come in with a fall a month prior and a month later now have this bleed, and they didn't realize that the two connection, because the bleed was so slow because it was from a vein, and it just built up in that space that has gotten bigger from the brain having shrunk. So I think if there's any suspicion, to really have an assessment done.
Yeah. Yeah, except if you have a stubborn senior or anyone who is, not, I'm actually referring to my father, who has since passed, but this had nothing to do with it. My father was a boxer, and later in years he did white collar boxing, and was hit in the head, and kind of had a little bit of a headache for a while, and that was really it. And he just would not, go to the doctor, and he came home from this event where he was, and it just got worse and worse. And finally, my brother had to physically kind of get him to go, and he had a subdural hematoma, and they had to drain it. And then, of course, as soon as the surgery was done, he went right back to his life, and it came back, and his brain was off the midline. It was like a whole thing, but it's so serious, because like what you were saying, Dr. Sabini, is sometimes it's not right after, he had all the garb on and everything, but it still happened. And so no one really thought that it was from that even until, things got really bad. We're like, hey, Dad, you did get hit in the head. So yeah, you really, and it was the second time they did it was a much more arduous kind of recovery too. I mean, they did not let him out of the bed. They were angling him down. It was, difficult. So it's really good to make sure you get checked out, like you're saying, as soon as something happens. I mean, if you're hit in the head and you may not even understand what's happening, because things can build up over time and tears can happen. So
I think that what can happen with older people, sometimes you mentioned the word stubborn, they could be living alone, they could fall, and they don't want to tell anybody, because they don't want people to take away their independence, or they'll be embarrassed, or all of the long list of reasons why they're not going to tell anybody. Maybe they fell a few times already, and they don't want to go to a nursing home, who knows what. And I think the biggest thing that we can try to do is encourage people to be open about it, and it's for your own good. Because if you keep hiding the fact that you're falling, that's not going to do anybody any good, including yourself. Mental approach.
Because the reason that you're falling could have to do with medication. It could have to do with some kind of inner ear off balance thing. It's not. It doesn't always mean that it's a fall or something like that. I like that. I mean, I don't know if it was an ambulance driver. Someone said, when you're talking to someone who has that feeling, saying something like, isn't it better to walk into a doctor's office to find out what's going on than to have to call an ambulance, eventually? So, by walking in and saying, hey, I'm having these kinds of symptoms, is kind of, there's probably nothing as severe going on. But, Otto, Project Independence, we're all about aging in place. So that's another thing we kind of promote. It's like, hey, we want you to age in place. So part of it is getting to the doctor and being proactive with your health and safety. But I know one of the things too that we actually did promote many years ago. We always promote it too. It was a program called Access to Home, where we work with United Way back then to kind of, we had funding, and we were making seniors' home a little bit more accessible, grab bars, and actually just going into the house and assessing the house and saying, hey, get rid of those lamp cords and, sharp corner tables, throw rugs, like Otto and I, we always talk about main level living. If you don't have to schlep down steps with a basket to do your laundry, or upstairs, many times a day. Early on, I remember this couple, the husband had Parkinson's and the wife was, really in great condition, but, they would go upstairs and downstairs multiple times a day. That's where their bedroom was. And she would go behind him and make sure that he was getting up the steps. And, she wasn't a huge person. She's like a normal, regular sized person. And then they both fell down the steps together. And that was, a problem then for him and for her. And, so it's really taking a look at your living, how you're living, to prevent things and to make things safer. And I know that was something, you were also promoting, talking about, Dr. Sabini, how preventing concussions in seniors.
Yeah. So you speak many points, and it's the language of what a physiatrist, right? What our specialty of physical medicine rehabilitation preaches. It's all about prevention. And we want to maintain that independence. And sure, I can see that fear in folks who say, I'm just going to end up in a nursing home. And I actually see folks here all the time, and that's my goal, to see if I can always try to get them home. But the goal is to get optimal. And if you're already having trouble with your balance and falls, it's just so much better to get yourself to a physical therapist who you can go see, who can optimize it, set you up with the right equipment. Okay, so maybe you might need a cane or a walker, but that's the risk that you should take, as opposed to a fall that could potentially have this domino effect of losing your independence and your home. And I agree, that couple who lives in a house and goes up and down the stairs, that's fantastic, right? But again, always trying to mitigate the risk. And certainly I'm not going to be the one to say you can't go up the stairs anymore. I want you to. But again, having that assessment and trying to get as much strength in them, optimizing their balance as possible, so that you, again, try to decrease that risk of falls.
Right. Yeah. Just being aware, of what you're doing at all times, just like we were talking about, even with your feet, if you're going to answer that phone, you're not, well, none of us are, 25 anymore, not even Christina, and she's pretty young, like you gotta kind of just, okay, take your time, get there. There's no race. There's, do things differently, do things to take care of yourself. It's really take the time to, take care of yourself, because the safer you are, the more the likelihood is that you're going to be, able to stay in your home, which is what we all strive for.
I don't think we're going to tell anybody that that's easy to do, because
No,
people have stuff that comes onto their mind, whether they be other health issues that put stress on the family or the house. Maybe not even you, could be another person within the house. So it isn't easy, to keep, like, we all know that the real thing to do in life is live in the moment.
That's right.
This is the moment. There are no more moments. We passed some moments already. And it's always easy to preach that, but to practice it all the time, that's another game altogether.
It's hard. It's certainly hard.
That's a goal, and it's a good one.
Right. It's funny. Like I'm talking so much today. I'm sorry. Cut me off, Dr. Sabini, if I'm, if something
Not
comes
at all.
in. Today in this yoga class that I taught, so I always try to do a theme. I talked a lot about control versus managing something. So if you took the word control and replaced it with manage, you'd see, things seem a little easier. Like I can't control my staff at work. My job is to manage them, from anything you want to control. I can't control my kids. I can't control their behavior, but I can manage it, and how do you manage it? If it comes to the point where if your balance is off and you can't control that, maybe it's something in the brain, something's happening as part of aging, and you're just not going to get it back. You can't control that, but you can manage it. Get a cane, or, it's like because taking control always implies losing control. But you can kind of come up with a plan to manage things that happen in your life. So it's not, doesn't sound as devastating as, I can no longer do this. You know what? Maybe can't do this exactly, but I can manage it, whether it's with a cane or, not going, moving my laundry to the main floor. Like, let me manage these things. And then, you're taking responsibility for, the next journey in your life, which is kind of just making sure you're safe. And, I know, Otto, it is so much more than, just saying, hey, Rebecca, that's a great idea. People have to kind of buy into it.
Well, we're knee deep in physical therapy in my home right now. As they know, my wife had a knee replacement, and we've gone now with just the third different PT person that we've gone to. Every PT person is not the same, as you well know, I think. They all have different styles. They have different compassion, different equipment, and the whole routine that goes with it. Well, we have a winner now, but the point I'm getting at is I go there, I bring her to the PT place, and when you see what goes on in these PT places, people who've just recovering from strokes, and it isn't easy. I mean, so for some people, just to walk from 6 feet is a big deal, or to lift a hand. So the goals are really relative to your personal situation. It's there's a lot of people going on with some very tough stuff, and I give them A+ for trying. That's strictly an editorial comment.
Yeah.
It's not easy. That's the point I'm saying, is you just have to keep trying, and that's all you can do.
Right.
Absolutely.
Yeah. People who are, used to, always doing and doing and doing. And then all of a sudden you're in that situation where, you got to slow down, or you got to go to physical therapy. But on that note, we're going to take a quick break. We'll continue with our guest, Dr. Sabini. Is giving us a lot of great information on people with falls and avoiding falls, and how to recover. And we'll be right back with Dr. Sabini on Project Independence in You.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with co-host Otto Lohse and radio show producer extraordinaire. It just sounds right, always, Christina Liu. And also, director of 88.1 WCWP.org, Dan Cox, who, is there and supports Project Independence since day one. We're so grateful for him too. College and the radio station. And we'll get back to our guest now, Dr. Rosanna Sabini. Thank you so much again for coming on. Over the break, we were kind of talking a little bit about sleep in seniors, and maybe things to be aware of. But there's so much so many issues, I think, as we age, having to do with sleep and sleeping patterns and getting up early, and everything seems to change. Like what was normal when you were younger up until maybe your 50s seems to kind of just be totally changed. I'm just wondering, why that happens.
So as we age, just our mechanisms for how we perceive kind of the day-to-day with our light, and darkness does get altered, and our melatonin levels, which is actually that natural hormone that helps us with sleep, can be altered in some folks. So you tend to want to fall asleep a little earlier, and then you wake up really early. And this is actually an issue that comes up with a lot of my patients who have head injuries. It's even more altered, and they're really struggling with feeling active and having that ability to get up and move in the day and just be way wakeful enough to just be able to handle what's coming at them. And so we try to always talk about sleep hygiene when it comes to head injuries and just general health, right? I always give sleep hygiene recommendations to all my patients because it's very relevant to how you're going to perform in the day. And certainly it's going to have an impact on how you physically function. So we talk about risk of falls. Certainly poor sleep can do that. So go ahead.
No, I'm sorry. Is melatonin something that can be tested for?
Yeah, they can test it. However, it's not something that even if you were to replace necessarily would change much when you take melatonin over the counter. It can offer some benefits. Some people have some improvements in their sleep patterns. Melatonin in small doses can help you fall asleep a little bit better, but it may not make you stay asleep. And there's different patterns of sleep. There's those that tend to have a really tough time going to bed and then staying and then falling asleep. And then there are those that fall asleep right away, but then wake up, can't go back to sleep. Or they wake up, go back to sleep, wake up, go back to sleep. And so they never really achieve that restful stage of sleep so that they feel refreshed in the morning. And so depending on what the specific issue is, you have to try to address and target what the actual cause are. So we always try to talk about how do you optimize your sleep. So one is to just pick a schedule, right? So it's that easy. Start out with picking a time you go to bed and a time you wake up and sticking to it. If you're having a hard time falling asleep, say at 10 p.m., then try to go to sleep around 10:30 and see how quickly you fall asleep. The goal is to try to, for those folks, to really get yourself tired for the evening so that you're more likely to fall asleep in the night. I try to say not to nap in the day, but obviously if you're about to pass out because you're so exhausted, then a short little cat nap can be beneficial, but not making it routine. So once we try to get the schedule in, then we talk about, okay, make sure you don't exercise too close to bedtime because all the endorphins of that activity are getting you awake. We also try to say don't eat or drink close to bedtime because certainly if you've had a lot of water or fluids, you're more likely to get up in the middle of the night. And that's also a source of falls for folks where they have to get up in the middle of the night. It's dark and they can lose their balance. Right. And then just keeping noises out, making it a comfortable temperature where you're not hot 1 minute, cold the next. And getting rid of any type of visual stimulation. So I always tell people, do not watch television when you're in bed, because then your brain says, oh, we're going to go to bed, but we're not going to sleep. We're going to have fun and watch some television. So that's a form of cognitive behavioral therapy that we try to teach patients about. How do you frame your brain to think about the bed as for sleep only, so that your brain is kind of trained to just think of the bed as for sleep, and that's where you go and rest. So keeping the bedroom for that restful time and not for eating in bed or watching TV is not something that we typically recommend to try to optimize that.
What about doing a crossword puzzle?
So I know a lot of people like to potentially read in their bed, do something relaxing. And certainly if that's not an issue for you to sleep, that's perfectly fine. But for those that may have trouble with sleeping, you might want to do that beforehand in a quiet place and then transition into bed. But for people who that's their normal routine and they're sleeping well at night, that's not an issue. This is more for those that are targeted that have trouble with sleeping or who may want to make it a little bit better.
I don't know if I read this somewhere, but like kind of along with the changes in sleep pattern, do we need less sleep as we get older? I feel like I've read that or I've heard that as we get older, we don't need as much sleep.
I don't know if that's necessarily what we should be recommending. Right. Certainly the changes in hormones can certainly affect the amount and quality of sleep, but we still need to get that restful sleep. I mean, everyone is a bit different. We always try to recommend 6, 7, 8 hours of sleep every night. But it also depends on the individual. Certainly not everyone's hormones may deplete as much as in someone else. So, you know, the goal is if you sleep and you're not having trouble sleeping and you wake up and you feel refreshed and it's 6 hours, I'm not sure anyone's going to say that that's not great. But if you're having trouble or you're having challenges in the day with your sense of fatigue, your wakefulness, then you probably need to seek some medical opinion, because as we age, we could potentially have other issues that can affect our sleep, and that can include sleep apnea. Maybe when you're laying down, there's fluid buildup in your lungs that you may not know about. So there's other medical aspects that as you age can, apart from the growth hormone aspects, can affect your quality of sleep. So as long as you have a physician that's checking in on all these things and you're talking to them about sleep, I think it's very important to address, because again, poor sleep can lead to just more fatigue in the day and more vulnerability.
You know, I have a Fitbit, and the Fitbit thing tells you, you know, how great your sleep was and how you were compared to the benchmark of other people in your age bracket. And I find it pretty interesting, actually. I think what it pointed out to me is that some of normal sleep is that you're not out cold all the time. Partly you are awake in between, and you go through the REM bit, and you know, there's different stages in sleep. So sometimes I think we may think, oh, we were dreaming, or we were doing this or that. We were awake for a while. And I think the bottom line there is I think that that's normal. You know, I don't think anybody sleeps through like a log, deep sleep for 8 hours or 6 hours. Is that a, you know, fact or fiction?
No, that's true. There's different stages of sleep, and there's light sleep, and then there's deep sleep. And all these different stages are important for different parts of day to day. So some helps restore some memories. It kind of just puts the right memory in the right spot so you can acquire it a little bit more efficiently later. So each stage does kind of its own thing. But yes, people go through different stages, and it's pretty cyclical. And you do have episodes of being awake, but not maybe in the sense that we perceive as awake. So you'll see that. Sure, I see that too in mine.
Well, I know, like, what happens to me is sometimes I come up with my best ideas when I'm sleeping. And then it'll be on my brain for something that we're working on or whatever. It'll be on my brain, and I'm afraid I'm going to lose it. So I just keep thinking about it. So what I started doing, frankly, is this thing is next to the bed, and I wake up and I send myself an email with this stuff that's on my brain. And then I put this thing back, and it works. It works good. Because once I get it off of the head, I'm afraid I'm going to lose this brilliant idea, you know, and I find it really is helpful. You know, I used to use a pad. Now, you know, we go electronic now, but it's the same idea.
Yeah. I like
Recommended?
Yeah, no, I think it's great. Of course.
Yeah.
I think that you're keeping yourself active mentally, and it sounds like you're getting pretty good sleep. It's hard, kind of like you know, remembering your dreams is the same kind of thing. You got to wake up, write it down right away, because then it just kind of drifts off into some sort of memory, and you'll never be able to remember it. So it's good that you do that. You're using the right tools to help you along.
You know, that's a funny thing too. Like years ago, I can't remember the medication I was taking. It was for blood pressure. And I would go into dreams that were like, it felt like they were lasting for 10 years. You know, I was a goalie in a hockey game and all kinds of stuff. And I remember every little detail. And I was like hallucinating from this medication.
Oh my goodness.
You know, I talked to the doctor about it. You know, I'd get up, I think I'm dancing with my wife. Yeah. And talk to the doctor, which again, I encourage, talk to the doctor about it, and decided maybe it is this medication, and took it away. I don't remember the name anymore, but changed it, and that went away. So medication can cause some strange stuff.
Absolutely. Absolutely. And certainly talking to your physician about what you're going through, because, it could be just medication. It could be some underlying condition. I mean, some people may not even realize that there's some mood disorder going on. There could be some depression that may be related to this. Certainly heart disease is another aspect of it. And as we age, we're a little bit more painful. And so arthritis can be a limitation to how well you sleep as well. The best thing about trying to get better sleep is also to get yourself tired for the day into the evening. So being active in the day, getting yourself outside, getting yourself in some sunlight, because again, that triggers our brain to say, okay, it's sunlight. And then as the sun goes down, that triggers a response in our body to say, okay, melatonin, go up. And that's how we start feeling a little bit more sleepy. So getting outside, getting some vitamin D, getting yourself active are all things that you can also do to help with your sleep as well.
So much great information. How would anybody listening or watching the show be able to get in touch with you or your department?
Sure. So I'm located at South Shore University Hospital, but I'm the director of the Northwell Health Concussion Program. So you can either reach to us by phone call. We have a call center that you can call, and it's 855-510-5110. Or if you just want to email us, it's concussionprogram@northwell.edu.
So much information to take in, and I'm sure dreams are probably a whole nother show, another show to do. But, again, just everything that we're talking about and any of the symptoms is so important to relay to your doctor. I mean, who would think Otto having these dreams would have anything to do with maybe medication, So, credits to you, Otto, for talking to your doctor about it and getting the medication changed, because all these symptoms are so relevant to what's going on, and you can prevent it and just maybe.
Well, to be honest about it, these dreams they were dangerous too, because I would get up, and I wouldn't just be dreaming that I was the goalie. I would actually be the goalie.
Yeah.
And and I was a lot younger then. But if I had those kind of dreams now, I could visualize some big stuff going on.
That's exactly what was going through my head, Otto.
Yeah. It was, it's hard to describe. I mean, I could describe every detail the next day. It was really scary, actually. Thank God it's not that was a long time ago and it got fixed. But if you don't tell people, that could have gone on for God knows how long before I hurt myself. Yeah. Anyhow, that's the whole story, right? To me, you talked about, it's scary that when you describe what a concussion is, it's basically shaking the brain in your skull. And you wonder why people would do things, in some cases, like your father boxing, and getting your brain rattled all over the place. And I can understand, frankly, and I like sports and I'm a sportsman, but I would, I'm past the stage of worrying about my own kids playing football, but grandchildren, you got to really think about that a little bit, I think. There can be some damage created there that you don't want.
For sure.
Yeah, and especially when he tried to get my sons to get in the ring. He always wanted to bring them. My father was friends with the owner of Gleason's gym in Brooklyn. And, he like his grandsons, he always wanted to bring my sons. And I was like, I really don't want them getting hit in the head. It's just not, nothing about, boxing's a great sport if you're into it, but it is very dangerous. It's a, direct hit every time you're in that ring. You're going to get hit in the head. So, but on that note, we're at the end of this segment, and Dr. Sabini, thank you so much for all this great information. I'm sure we'll have you back on again. We really appreciate it and very interesting. We do have to take a break, and we are going to be back with Christina Liu and Talk of the Town in our next segment. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org.